Welcome back. This is Dr. Strange. Myasthenia Gravis. Have you heard of it before? If not, we are going to tell you what you need to know about Myasthenia Gravis. Myasthenia Gravis, MG, is a chronic autoimmune disorder in which antibodies destroy the communication between nerves and muscle, resulting in weakness of the skeletal muscles. Myasthenia gravis affects the voluntary muscles of the body, especially those that control the eyes, mouth, throat, and limbs. The disease can strike anyone at any age, but is more frequently seen in young women between 20 to 30 years of age and men aged 50 and older. Myasthenia gravis crisis can involve difficulty in swallowing or breathing. The cause of myasthenia gravis is unknown and there is no cure for it, but early detection and prompt medical management can help people live longer, more functional lives. So we ask today, what causes myasthenia gravis? Myasthenia gravis is not inherited and it is not contagious. It generally develops later in life when antibodies in the body attack normal receptors on muscle. This blocks the chemical needed to stimulate muscle contraction. A temporary form of myasthenia gravis may develop in the fetus when a woman with myasthenia gravis passes the antibodies to the fetus. Generally, it resolves in 2 to 3 months. So we ask, what are the symptoms of myasthenia gravis? The first one is visual problems, which includes drooping eyelids, also called ptosis, and double vision, which is called diplopia. Another symptom is muscle weakness and fatigue, which may vary rapidly in intensity over days or even hours and worsen as muscles are used. Another symptom is the facial muscle involvement, causing a mask-like appearance. A smile may appear more like a snarl. Number 4, trouble swallowing or pronouncing words. And number 5, weakness of the neck or limbs. So the symptoms of myasthenia gravis may look like other conditions. Always see your doctor for a diagnosis. Flare-ups and remissions may occur now and then during the course of myasthenia gravis. Remissions, however, are only rarely permanent or complete. So how is myasthenia gravis diagnosed? Your doctor can diagnose myasthenia gravis based on your symptoms and certain tests. During the physical exam, your doctor will ask about your medical history and symptoms. A common way to diagnose myasthenia gravis is to test how you respond to certain medicines. Muscle weakness often dramatically improves for a brief time when you are given an anticholinesterase medicine. If you respond to the medicine, it confirms myasthenia gravis. Other tests can be done, which include the blood test, genetic test, nerve conduction studies, electromyogram, EMG. And we ask, how is myasthenia gravis treated? Remember, myasthenia gravis doesn't have a definite treatment, but specific treatment for myasthenia gravis will be determined by your healthcare provider based on how old you are, your overall health and medical history, how sick you are, how well you can handle specific medicine, procedures, or therapies, how long the condition is expected to last, your opinion or preference. There is no cure for myasthenia gravis, like we stated earlier, but the symptoms can often be controlled. Myasthenia gravis is a lifelong medical condition. Early detection is the key to managing the condition. The goal of treatment is to increase muscle function and prevent swallowing and breathing problems. Most people with this condition can improve their muscle strength and lead normal or near normal lives. In more severe cases, help may be needed for breathing and eating. So the treatment may include, number 1, medicine, anticholinesterase medicines, steroids, or medicines that suppress the immune system's response, that is, immunosuppressive medicines, may be used. Thymectomy, which is the surgical removal of the thymus gland. Plasmapheresis, that is a procedure that removes abnormal antibodies from the blood and replaces the blood with normal antibodies from donated blood. Then immunoglobulin, a blood product that helps decrease the immune system's attack on the nervous systems. It is given intravenously, that's IV. So what are the complications of myasthenia gravis? The most serious complication of myasthenia gravis is a myasthenia crisis. This is a condition of extreme muscle weakness, particularly of the diaphragm, and chest muscles that support breathing. Breathing may become shallow or ineffective. The airway may become blocked because of weakened throat muscles and buildup of secretions. Myasthenia crisis may be caused by a lack of medicine or by other factors such as a respiratory infection, emotional stress, surgery, or some other type of stress. In severe crisis, a person may have to be placed on a ventilator to help with breathing until muscle strength returns with treatment. So precautions which may help to prevent or minimize the occurrence of myasthenia crisis include 1. Taking anticholinesterase medicine 30 to 45 minutes before meals to reduce the risk of aspiration, that is food entering the lung passages. 2. Taking anticholinesterase medicines exactly as prescribed to help maintain the strength of the breathing muscles. 3. Avoiding crowds and contact with people with respiratory infections such as the cold or the flu. 4. Taking in proper nutrition to maintain optimal weight and muscle strength. 5. Balancing periods of physical activity with periods of rest. 6. Using stress reduction techniques and avoiding emotional extremes. So you tell your healthcare provider about your condition when any medicines are being prescribed. So when you are living with myasthenia gravis, how do you do it? Since you know that there is no cure for myasthenia gravis, but the symptoms can generally be controlled. Myasthenia gravis is a lifelong medical condition. Early detection is the key to managing this condition, and the goal of every treatment is to increase general muscle function and prevent swallowing and breathing problems. So most people with myasthenia gravis can improve their muscle strength and lead normal or near-normal lives in more severe cases. Help may be needed in carrying out some activities. Hope you've learned something good. Hope you've learned something new. Whatever you have to say, drop your comments in the comment section. And don't forget to subscribe to this channel as we bring you more interesting, strange diseases. Thank you very much.